Hi everyone, my name is Michelle and I'm currently an officer of the Red Cross Club at my school. I am very passionate about helping and teaching others how they can help themselves as well as those around them. I myself am trained in health and safety and I'm also CPR certified. If you have already watched my video or saw my presentation for hands-only CPR, good news! A lot of this will be review for you. I also want to inform you that I will have a health and safety training course coming out and CPR is related to many of the topics I will be covering. Now today I will be teaching you what is CPR, how it is helpful, and how you can perform it safely and properly. I will be covering both the chest compressions as well as the rescue breaths. First things first, what is CPR? CPR, also known as cardiopulmonary resuscitation, is an emergency life-saving procedure that is performed on someone who has had a cardiac arrest. Some examples of a scenario in which you should perform CPR on someone includes when they have received an electric shock, had a heart attack, or was just drowning, in which the victim has stopped breathing or their heart has stopped beating. CPR is comprised of chest compressions and rescue breaths. Both of these things are vital. Blood carries oxygen to different parts of the body via the heart. If body tissues do not receive oxygen, they begin to die. When we do the chest compressions, we are helping the heart to give blood to vital organs such as the brain. But why should you learn how to do CPR? In case of an emergency, you can be the difference for someone you love. Studies have shown that 70% of out-of-hospital cardiac arrests happen in homes. 90% of people who suffer from out-of-hospital cardiac arrest die. CPR, especially if performed immediately, can double or even triple a cardiac arrest victim's chance of survival. With CPR, you can save a life, whether it's a friend, family member, or a total stranger. Now, let's begin. For chest compressions or hands-only CPR, there's only two simple steps. When you see an unconscious person, the first thing you do is call 911. Either ask someone nearby to help you call 911 or make the call yourself. Check your surroundings and make sure there is no potential danger around you. Then check the person. Gently tap them on the shoulder. Do not pound them or shake them vigorously, just a tap. Look for signs of life. Tilt their head and lift their chin slightly to open their airway. Lean in towards the person's nose or mouth to check for breathing. If there is no movement, breathing, or any other sign of life, then begin to perform the chest compressions. Kneel next to the person and place one hand over the other and interlace your fingers as shown, with your non-dominant hand over your dominant hand. Place the heel of your hand on the center of the person's chest, or their sternum, and push down hard and fast. Each push should be at least 2 inches and no more than 2.4 inches down. Make sure that your arms are straight and your elbows are locked. Make sure that you are positioned in a way that your shoulders line up directly above your hands. You should maintain a steady rhythm of 100 to 120 beats per minute. If you don't know exactly how fast that is, that's okay. Just think of a song. Some songs that have the correct pacing include Staying Alive by the Bee Gees, Hips Don't Lie by Shakira, and ABBA's Dancing Queen. In fact, the Baby Shark song is a great example of a song that is 100 to 120 beats per minute. If you don't think you can come up with a song fast enough, get a metronome app beforehand or search for the correct tempo on YouTube. Also, make sure that you're counting the correct amount of chest compressions. For hands-only CPR, you would just continue your compressions, but when doing full CPR, do 30 chest compressions and 2 rescue breaths for 5 cycles. You must make sure that you complete each cycle. You must not stop and then start again when doing the compressions. The movement must be continuous. The only reasons why you would stop performing CPR on someone is if the scene has become unsafe, there are signs of life, such as breathing or movement, another trained responder arrives and takes over, an AED is ready for use, or you are too exhausted to continue. You must remember that CPR may cause injuries to the individual, such as damage to the ribs or the cracking of the sternum. However, despite these injuries, you should continue to perform CPR, as saving a life outweighs the presence of a few injuries. Now before we move on to the rescue breaths, note that your hand positioning and how deep you push depends on the person. We already know what to do for an adult, where an adult means ages 12 and older. But for a child under the age of 12, use one hand, and for an infant, use 2 fingers and push only 1.5 inches downward. Make sure that you push more gently for a child or an infant. Now if you want to practice the chest compressions, do not use a live human being. If you would like to, you can make your own DIY CPR mannequin using the link provided below. Now for the rescue breaths, you want to do 2 of these per cycle. Make sure that their mouth is clear. Then tilt their head back slightly and lift their chin. Pinch their nose shut. Then place your mouth fully over theirs and blow to make their chest rise. If their chest does not ride with the first breath, retilt their head. If the chest still does not ride with the second breath, then the person might be choking. If that's the case, move on to the chest compressions. I will have a video and presentation about choking rescue that goes along with the health and safety training course, so look out for that for more detail. So what questions might you have? Well, you might be wondering, do you need to be CPR certified in order to perform CPR? No, technically, you do not need any formal training or any special certification to perform CPR. However, you do need the education. Knowing CPR can possibly help you save a life one day. If someone near you suddenly has a cardiac arrest, don't be afraid and just be prepared. However, in a situation where someone were to collapse from a cardiac arrest and another person nearby is actually CPR certified, allow them to take over and handle the situation. Just be aware and be available to jump in to help at any time. Now you also might be wondering, well, when and where can I get CPR certified? Technically, you can get CPR certified at any age, for there is no actual age requirement. The ability to actually perform CPR is based more on your body strength, and it has been known that children as young as 9 years old can learn and retain CPR skills. I was personally CPR certified last year at my local Youth Red Cross chapter, where I took a class and was tested to see whether I actually knew how to do CPR. But you can get CPR certified with an online course through the American Heart Association or through the Red Cross. You can also get CPR certified at your local school or your local fire department. If you have any other questions, don't be afraid to search it up, and you can even email me here. Now let's recap. What's our first step of our 2 simple steps for hands-only CPR? That's right, call 911. How many chest compressions do we need to do? 30. And how many rescue breaths? 2. Brilliant! And remember that your movement must be continuous. You cannot stop. Congratulations! You now know how to do full CPR.